Hi there, welcome again to familydoctor.expert. Today we're going to talk about vaccinating household contacts against the whooping cough. Very important to do. Whooping cough, bad disease, definitely don't want to get it. Babies are really vulnerable. I remember when I did my pediatric term seeing a little one who contracted the whooping cough. They cough and cough and cough, and then they do a big whoop at the end. That's where it gets its name. It's actually caused by the bordetella pertussis, and this disease involves a lot of coughing, and there are complications, and unfortunately, pneumonia, even brain damage, even death is a possibility with the whooping cough. So this is something we want to avoid. Fortunately, a lot of the community are vaccinated, so that reduces the risk. But here's the thing, new babies are vulnerable to it, and until they've had their 2-month and their 4-month vaccinations, they potentially can contract whooping cough. So we don't want that. So we're trying to make sure that everyone around the baby is actually vaccinated. Now there's a whole discussion about mums in their 3rd trimester having the whooping cough vaccine, which I'm not going to talk about here. What we're really focusing on are the household contacts. So that's the dads, the grandparents, maybe aunties and uncles, carers, babysitters, anyone that's going to be around the baby, especially in those first few months. And the rule is something like this, that if the contacts have not had a vaccine in the last 10 years, the safe thing to do is to go along to the GP and get the whooping cough vaccine. Now, the thing about whooping cough is that it's highly catchy. So if you've got someone with whooping cough near someone who's not immunised, 80-90% chance they're going to catch it from the little water droplets in the air. So it's super catchy, and it might not manifest for between 1 and 3 weeks before we really see all the symptoms. So this is something that we really want to get onto. Now the actual whooping cough, it comes as a whooping cough vaccine comes as a combination. So it's actually called DPT IPV. So it actually comes with vaccinations against a few other diseases, which are good to have, especially if you're doing lots of travel. But diphtheria and tetanus get covered, and also importantly polio gets covered, which is awesome, as this is starting to get resurgence in some countries around the world. So I think it's a good idea if you're the loving father/grandparent, auntie, uncle, people who's going to be hanging around new baby, go along to your GP, get the whooping cough vaccine, no big deal, highly recommend it. Anyway, as usual, disclaimer, don't make a decision just based on this fantastic video. Go along to your GP, talk about your individual situation, your risks of the vaccination, whether or not your GP thinks it's a good idea. But at least you'll go along informed with some good questions, and I wish you well from familydoctor.expert.